Welcome to OAMGA's Silver Jubilee year. The year 2006 is an important and exciting year in the history of the Overseas Australian Medical Graduates Association, as it is the 25th anniversary of the association. On this joyous occasion of the Silver Jubilee, we will take you down memory lane and reminisce about the trials and tribulations on reaching this very important milestone. Medical practitioners from the Indian subcontinent and South Asia have traditionally been attracted towards Australia by common denominators such as the Commonwealth, cricket, and even curry. Further drawcards have been the laid-back lifestyle and the spirit of mateship. The migration of medical practitioners started in the early 70s, during the period of Prime Minister McMahon. Initially, medical registration was open to all overseas doctors in New South Wales and other states, but in 1978 the federal government introduced the AMC examinations as a prerequisite for overseas medical practitioners to gain full registration. In 1981, a number of overseas doctors, namely Dr. Marka, Dr. Hemachandra Rao, Dr. Govindan, Dr. Pawani, Dr. Malhotra, Dr. Patel, Dr. Rabindranath, and Dr. Tint, came together to form the Overseas Medical Graduates Association. The association was born out of the frustration felt by doctors who were experiencing difficulties with the problem of registration. In 1993, the Medical Board of New South Wales introduced legislation compelling overseas doctors to be deregistered if they did not remember to renew their registration. These practitioners were then forced to sit the AMC examination to renew their registration. This was discriminatory, as the same rule did not apply to Australian or AMC qualified practitioners. OAMGA vigorously lobbied the State Health Minister and the New South Wales Medical Board for this legislation to be rescinded, and was successful. The fundamental aims of OAMGA are to protect the interests of members by working with the Australian Medical Council to improve examination methods, as well as the New South Wales Medical Board and the New South Wales AMA. A further aim is to assist Overseas Trained Doctors Association members who are not registered to practice in Australia in guidance regarding bridging courses and RACGP training courses. Another vital role has been to provide liaison with other medical associations, including the Chinese, Vietnamese, and Arabic medical associations. OAMGA has been extremely active in professional development of its members, providing continuing medical education lectures as well as overseas conferences which have been very well attended. There has been a key role in public awareness of health issues, as exemplified by the volunteer medical stalls held annually at the India-Australia Friendship Fair. Finally, OAMGA is committed to promoting postgraduate research and has funded a research. OAMGA was launched in the 1980s to address the problems of medical graduates from overseas and their registration. Leaders of OAMGA at that stage, such as Dr. Nazir Ahmed, negotiated tirelessly with both federal and state AMA bodies to ensure the registration of migrant doctors, as well as the portability of registration interstate. OAMGA has consistently succeeded on behalf of its members in achieving influence where it counts. In 1986, for example, the Secretary of OAMGA, Dr. Marka, became a member of the New South Wales Medical Board and subsequently went on to become a member of the Ethnic Affairs Council of New South Wales. In the subsequent years, OAMGA, its presidents and executive committees have achieved a great deal, and now is a time for us to reflect upon these achievements and celebrate them. There are several achievements for which current members of OAMGA, myself included, should be extremely grateful to the original founders and current executive of OAMGA. In 1989, the president of OAMGA, Dr. Hemachandra Rao, succeeded in joint meetings with the AMC to develop a proper and acceptable procedure for the examination of migrant doctors, which is operative and present to this day. In 1992, the work of OAMGA was recognized by both state and federal AMA under the presidency of AMA President Dr. Brendan Nelson. That relationship with the federal AMA continues in a very warm and productive fashion with the current president, Dr. Mukesh Haikwal, whom we are honoured to have here today. OAMGA is hoping to develop a similar working relationship with the RACGP under its new president, Dr. Vasantha Pritham, whom we are also honoured to have here today. In 1990, the AMA of New South Wales agreed to co-opt an OAMGA member to the New South Wales AMA Council. Dr. Hemachandra Rao initially attended the council meetings regarding the concerns of overseas doctors, and subsequently Dr. Bhatia took over the role as nominee to the council. OAMGA is proud to be responsible for several fundraising activities which have made a significant contribution to the wider community. The first of these took place under the leadership of Dr. Surendra Borka and his executive committee in 1997 for the Fred Hollows Foundation. A magnificent event took place at Darling Harbour, with the compere being none other than Ray Martin from Channel 9. The evening was a tremendous success, and a donation of more than $10,000 was raised for the foundation. In subsequent years, OAMGA proudly donated $10,000 raised for the Westmead Children's Hospital, and a further $10,000 the following year for the victims of the Gujarat earthquake in India. OAMGA members may be surprised to understand the depth of service provided to us by the volunteer members of the executive committee over the years. For example, OAMGA Secretary Dr. Sarika in 2000 spent a year developing a members directory with comprehensive information about the languages those practitioners spoke and the services they provided, not to mention local services including hospitals and allied health that would be a benefit to their patients. This proves to be a valuable guide and assistance to members to this day. Furthermore, the role of any professional medical body is to promote professional development of its members, and OAMGA takes continuing medical education extremely seriously. Several lecture programs have been organized with the untiring efforts of doctors such as Dr. Pawani, Dr. Srinivasa, and current President Dr. Nagamar, with the help of her executive committee and assistance from pharmaceutical companies. Overseas conferences have played a major role in development of members. The first overseas conference took place in Queenstown, New Zealand in 2002 and was a tremendous success, coordinated by OAMGA Secretary Dr. Sarika. The second conference again was a success in Kenya, East Africa in 2004, coordinated by Dr. Borka. Members will be excited to learn of the overseas conference planned for 2007 to be held at the Palace on Wheels in India, coordinated by Dr. AIMGA. A research scholarship was proudly sponsored by OAMGA in 2005, and the inaugural winner was Dr. Raj Puranik for research into the incidence of CVA in South India. A powerful example of OAMGA's advocacy on behalf of its members occurred last year at the height of the media frenzy over the adverse effects that occurred in Bundaberg, Queensland. An overseas trained surgeon was held responsible for many adverse outcomes, and several overseas doctors in rural areas in particular felt the backlash. OAMGA members were reassured to see leadership member Dr. Orakondi going on talkback radio, basically to state that not all overseas doctors should be tarred with the same brush as the doctor affected. OAMGA takes public health extremely seriously. This has been demonstrated by the volunteer medical stall, which has been manned for the past 4 years by OAMGA volunteers, including Dr. Orakondi, Dr. Prakash, Dr. Nagama, Dr. Rekha Rao, and in 2006 headed by Dr. Sundar. The doctors involved on each day have come from busy practices during the week, giving up a Saturday afternoon to promote health messages, including lifestyle changes to prevent hypertension, diabetes, osteoporosis, and obesity. Indeed, during the screening process at the last medical stall, several new cases of diabetes were diagnosed, potentially preventing complications in these unsuspecting stall visitors. This year, the president of OAMGA, Dr. Nagama, has even initiated a medical segment on TV channel TVS, which has been extremely well received by the Australian public, leading to several comments from patients in their doctor's surgery. In 2005, a website was established to enable easy communication for members online, as well as access to important events and activities of OAMGA. This community portal, www.oamga.org.au, was created thanks to the efforts of Mr. Onkaswamy and his team. It provides a venue and a forum for members to communicate online. OAMGA has been extremely fortunate over the last 7 years to have the diligent services of Mrs. Gillian O'Doherty, who has assisted the Executive Council in coordinating OAMGA's work at its head office. As you can see, today OAMGA has grown into a strong, vital and influential organisation for its members. Its main focus will always be service provision as well as continuing professional development for OAMGA members, but increasingly OAMGA has had to shift its focus towards important public health issues. It is important to reflect upon and celebrate the achievements of OAMGA in the last 25 years in protecting its members' interests. These were the results of a considerable volunteer spirit, and we current and future members of OAMGA can take inspiration from their efforts in carrying on their mantle of service and achievement. We all look forward to the continued growth and success of OAMGA, and may we take this moment to congratulate most sincerely the office bearers led by President Dr. Nagama and her team, Dr. Prabhat Sinha, Dr. Yadu Singh, Dr. Surendra Borka, Dr. Sarika, Dr. Patel, and the entire Executive Committee for a successful Silver Jubilee year. Thank you, ladies and gentlemen.